You've probably tried everything for your chronic back pain: medications, stretches, maybe even injections. But what if I told you there's a non invasive treatment that could reduce your pain by 64%? That's what the latest research on shockwave therapy for lumbar facet joint pain is showing, and it's turning traditional treatment approaches upside down. Hi, I'm Dr. Jason Hahn, CEO of HealthFit Physical Therapy and Chiropractic. And in today's video, I'm thrilled to introduce to you a revolutionary, scientifically validated treatment that is reshaping how we manage stubborn back pain. It's called Focused Extracorporeal Shockwave Therapy, also known as ESWT. For far too long, we've believed that the best treatments for chronic lumbar facet joint pain are invasive. Procedures like steroid injections, nerve blocks, or radiofrequency ablations. The problem is, these approaches often provide only temporary relief, leaving patients frustrated and still in pain. But as an expert who spent years working in professional sports and treating complex pain conditions, I found a better solution. Unlike steroid injections or nerve ablations that simply numb the pain temporarily, shockwave therapy actively promotes healing at the cellular level. It works by delivering precisely targeted acoustic pressure waves to damaged tissue, stimulating your body's natural healing mechanisms. This increases blood flow, reduces inflammation, and activates stem cells exactly where they're needed the most. The recent groundbreaking study that highlights these results was published in the respected International Journal of Surgery. Researchers examined 128 patients who had chronic lumbar facet joint pain, confirmed by the gold standard diagnostic medial branch block. Participants were randomly split into two groups. One received real focused shockwave therapy once a week for 5 weeks, and the other group received a placebo treatment. Neither the patients nor the assessors knew who was receiving a real treatment, making the results even more credible. Here's why the findings from this study are so powerful. Patients who received genuine shockwave therapy experienced an incredible 64% reduction in their pain levels after 1 year. Disability scores improved dramatically by over 42%, translating to significant improvements in day-to-day activities like walking, working, and playing without that constant nagging discomfort. Remarkably, MRI scans demonstrated visible reductions in bone marrow edema, a key factor associated with chronic pain, in nearly 60% of treated patients. Think about what that means. This isn't just temporarily masking your pain. This is creating genuine biological healing in your body. And these weren't just short-lived results. Follow-up assessments at 6 and even 12 months showed that patients maintained their improvements, indicating true long-term healing rather than just temporary relief. I've seen the real-world impact of this treatment firsthand here at HealthFit. For instance, one of my patients, Lisa, she spent years cycling through traditional treatments: physical therapy, injections, medications, but the relief was always short-lived. After a few sessions of focused shockwave therapy, Lisa reported feeling the most significant and lasting improvement she'd experienced in years. She could finally enjoy her daily walks without pain and play with her grandkids without hesitation. Stories like Lisa's reinforces why scientifically backed treatments like shockwave therapy are so essential. One of the greatest advantages of focused shockwave therapy is that it's completely non-invasive. There's no needles, there's no medications, and virtually no downtime. Each session takes only about 15 minutes, and you can immediately return to your normal activities afterwards. Research like this is vital because it validates treatments we already see making a difference. Shockwave therapy isn't a completely new idea. It's already effectively used for treating conditions like plantar fasciitis, tendonitis, and even knee arthritis. But robust studies specifically validating its effectiveness for chronic lumbar facet joint pain are critical. They empower you, the patient, with confidence and knowing you're choosing a scientifically supported approach. So, if you've been told repeatedly, you'll just have to live with your back pain, this research proves otherwise. Sometimes the most effective solutions aren't the most complicated or invasive ones. Sometimes your body simply deserves a chance to heal naturally. And here's what you can do right now to take control of your back pain. Schedule a personalized consultation with our team here at HealthFit. We will determine if focused shockwave therapy can help you regain your active lifestyle. Share this message with someone who might be trapped in a cycle of chronic pain, unaware that this option exists. Follow our page and subscribe to our channel so you can stay informed about cutting-edge, evidence-based treatments designed to help you live pain-free. Your journey to lasting relief starts with one powerful step: making the decision to pursue treatments that truly heal. Thank you for watching, and here's to your health and freedom from pain. Hey, if you found this video useful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for our latest tips coming to you every week. Share this video with your family and friends. It might just make their day a little bit better. I'll see you soon.